Hey, if you think you're becoming eligible for Medicare and Medicaid, this is the 2023 dual eligible standards. This is from CMS, the Centers for Medicaid and Medicare Services, that was released. And so there's 4 different classifications or Medicare savings programs. I'm just going to go over the income and asset limits, and then from there you can decide whether or not you're within the eligibility of those income and asset limits. After that, you can either contact your state Medicaid program. They're all named differently because it's state-based agencies, or you can contact me at mike@medicaresavings.us for more answers on dual eligible special needs plans. Those are that could be available in your area because you qualify as being a Medicare and Medicaid beneficiary. All right, with the first one is qualified Medicare beneficiary, QMB. The monthly income limits is 100% of the federal poverty limit plus $20. For individuals in all states and DC, it's $1,235. It's $1,663 for couples, with exception to Alaska and Hawaii. Those are different. Alaska is right above $1,500 for individuals and right above $2,000 for couples in Alaska. In Hawaii, it's right around $1,400 and for individuals, and right around $1,900 for couples. So the next classification is Specified Low Income Medicare Beneficiary, SLMB. So the monthly income limits is 120% of federal poverty limit plus $20. That would be a little bit more in all states and DC. That's $1,478 for individuals, $1,992 for couples. Again, Alaska and Hawaii are different. It's going to be $1,841 for individuals, $2,484 for couples in Alaska. In Hawaii, it's going to be $1,697 for individuals, $2,288 for couples. The asset limits are the same in both qualifications, both in QMB as well as SLMB. You must have limited assets, so your assets cannot be more than $9,990 for individuals and $13,630 for couples, both in QMB as well as SLMB. All right, let's move on to the next one here. Qualifying individuals. So for this one, the monthly income limits is going to be 135% of federal poverty limit plus $20. All states and DC except for Alaska and Hawaii. So it's going to be a little bit more. It's going to be $1,660 for individuals for this QI, and then $2,239 for couples that are eligible for QI. The asset limits are the same as before, $9,900, $13,630. Alaska and Hawaii are going to be a little bit more, obviously. Alaska is at right above $2,000 for individuals, and for couples, it's $2,792 for Alaska. Hawaii is $1,907 for individuals, $2,572 for couples. And the last Medicare Savings Program is called Qualified Disabled Working Individuals. And so the monthly income asset is actually 200% above federal poverty limits, FPL, plus $20. All states in DC except Alaska and Hawaii. So that's going to be a lot more. That's going to be $4,945 for individuals. And obviously it says disabled in there, so you must have a qualifying condition. And then for couples that are both disabled or qualify for the disabled working individual, it's $6,659. Alaska is going to be a lot more. It's going to be $6,155 for individuals, $8,299 for couples. And then Hawaii is going to be $5,675 for individuals, and Hawaii is going to be $7,645 for couples. The asset limit is $4,000 for individuals, and then $6,000 for couples. So your assets are going to be less. Your income is going to be more for a QDWI. So those are your Medicare savings programs that if you are qualified for a Medicare and Medicaid, this is where you would look into what the limits on their income and assets, and then assess if you'd be eligible. If you are eligible, contact your state Medicaid agency, and then from there you can actually look at the different types of insurance in the marketplace, whether it's an MMP, Medicare-Medicaid plan offered by the state and CMS as a coordination of benefits of both agencies, or you can look into dual eligible special needs plans. They're also known as D-SNPs. So that's something that is individual, and their individual health plans for dual eligible Medicare and Medicaid beneficiaries. If you need more information on that, I'd be happy to help. You can contact me at mike@medicaresavings.us, or contact us on our hotline at 1-888-608-0654, or just go on to medicaresavings.us. Take care.